how to apply and remove a foam dressing. Start by washing your hands and gathering all your supplies and putting on your gloves. Next, clean the wound with saline or cleanser. Pat the peri-wound dry, but avoid drying the wound bed. Then next you're going to apply the dressing by peeling off the protective backing and center it directly over the wound and soothe the edges around the outside. So it does have the two peel back layers here. So what you're going to do is you're going to remove one. Okay. And you're going to apply that. Now, obviously, you're going to be wearing your gloves and you've already cleaned the area, but I'm just showing you quick here, just nice and easy. And then, so the other half is still on, and this is what keeps it sterile. So you don't want to be touching the inside of the dressing. So you remove one half and apply it, and then you remove this other one while it's on. So you just slightly pull back and it applies it really nice for you. Okay. And then you just push down the edges here so it has good adherence. And that's what the dressing looks like. It moves very nice. It doesn't feel like I have anything on my arm. It has the nice thick pad here to protect the wound, but it feels very, very comfortable on. I absolutely love these dressings because it just conforms to the skin. They stay on for 3 to 7 days, which is a really good length of time when you're not continuously messing with the wound. That's what allows it to heal. So the longer you can leave it on, as long as you don't have an infection, it is better. I always suggest 3 to 4 days to leave a dressing on, as long as the dressing is controlling the amount of exudate coming out of the wound. And then to simply remove this, you just start peeling at the edge here. So it sticks so great, but it also comes off so nicely, and it doesn't hurt. Like, I have hair on my arms. It doesn't hurt like a Band-Aid would. So you just start peeling it back nice and gently, and it just comes off very, very easy. Now, if you are having any pain, you can always, when it's on there, and you start peeling it back, you can add a little bit of saline here, and it lets it release very nicely and not be so sticky. But this isn't a real sticky bandage. It sticks well to your skin, but the removal, it doesn't hurt.